COVID-19. Coronavirus. SARS-CoV. There are many virus names to classify this. Yet, there's no doubt that this changed the multiple factors of our lives. Day after day, the number of cases is increasing. More people are dying daily based and lost their jobs. Restrictions are getting more severe as time goes, yet it feels like we are walking toward the endless tunnel. Then what is COVID-19 after all? Some might say it's the virus that caused the worst pandemic in a century. Some scientists would say it's a virus with subfamily Orthocoronavirina. Some healthcare professionals would say it's a virus that can cause pneumonia with similar symptoms to the common cold. Some conspiracy theorists would say it's the human-made virus that will change this world. Well, I would propose a different definition. COVID-19 virus pandemic is a reminder. A reminder of the definition of a pandemic. A reminder of fear of the unknown factors and their impact. A reminder of a pandemic that we forgot for a century. A reminder of healthcare professionals' existence and their meanings in our life. Good afternoon. It is a pleasure to introduce myself to whoever is watching this video. The following videos will combine the research-based articles for the theoretical perspective and my personal experience for the practical view. Any feedback would be appreciated. Please let me know if there's any information you would like to add/correct. That being said, back to the original question, what is COVID after all? WHO defined coronavirus disease known as COVID-19 as an infectious disease caused by a newly discovered coronavirus. People infected with the COVID-19 virus will experience different symptoms, but mainly cough, fever, headache, diarrhea and vomiting. Some severe cases are a respiratory failure or cardiovascular disease. The best prevention is known as proper hand hygiene, wearing a mask and social distancing. Severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2. But we are more familiar with the name of COVID-19 or coronavirus. From the name itself, we can assume that virus will impact the respiratory system critically. Yet, we are quite familiar with this virus already. SARS from 2002. MERS from 2012. COVID from 2019. All these viruses contain the base of the coronavirus. This simple, but also extremely complicated virus caused multiple outbreaks over the last 2 decades, yet the proper solution doesn't seem to appear any soon. Then what makes this virus so unique and so vigilant? There are many different ways to answer this, but I would like to emphasize that this is an RNA virus. The simplest definition would be a virus in which the genetic information is stored in the form of RNA. For example, there are Zika virus, COVID virus, MERS, SARS, H1N1 influenza, dengue virus, Ebola virus and so on. On the other hand, there are DNA viruses such as herpes virus, smallpox virus, adenoviruses, papillomavirus and many others. Indeed, we are quite familiar with both types of virus, yet as mentioned previously, the RNA virus seems to be more vigilant and dangerous than the DNA virus. How so? I would remind you that an RNA virus is a single-strained virus. This means that it has less stability compared to the DNA virus and causes more frequent mutations. Some may say mutations means the virus will be more fragile and weaker. Yet that's not always the case. For instance, currently, there are multiple different strains of the COVID-19 virus, but we would identify this as 8 major strains of the coronavirus. Be aware that this number of mutations increases as a matter of time. Also, previous interventions might not work anymore and it requires different interventions.